Well, and the COVID-19 pandemic remains the most pressing challenge of our country and indeed around the globe. For more than a year, the new normal, as is now known, has forced each one of us to adjust. I dare say there is no more difficult a season to be in charge of a country than this one. Whichever decision you make is painful in one way or another. Inaction is even worse. Maybe the 33rd President of the United States, Harry Truman, had such times in mind when he said, "There is some risk involved in action. There always is, but there is far more risk in failure to act." End of quote. When President Uhuru Kenyatta on 26th of March 2021 addressed the nation, he issued a raft of measures to tame the rising COVID-19 numbers in the country. Almost a month later, the conversations are beginning to surface. Just how effective or otherwise have the measures been? At that time of the announcement, as is now, and has since been since March last year, it's a delicate balancing act for the country's leadership. The president himself saying he has to continually balance between lives and livelihoods. I would liken it to juggling a lever, as the late cabinet minister John Mishuki aptly phrased it some years back. I suspect President Uhuru Kenyatta will be addressing the nation anytime from tomorrow with a view to assessing the measures he issued a month ago. And as he does so, the ultimate question should be, are we in a better place than we were a month ago? Are the measures he issued a month ago working? Is it time to review some of the measures without losing the critical reason that informed them in the first place? Thomas Vato, a writer, tells us that if you cannot trust people, trust numbers. Even if they look unbelievable, they never lie. Since 26th of March 2021, the country has registered 26,214 new COVID infections and 462 deaths, or an average of 17 fatalities reported each day. During the same period, the number of patients in intensive care units across the country is 240, up from 124, with the total number of patients admitted in various health facilities shooting from 1,192 to 1,509. The average positivity for the month of March is 14.3%, and the positivity rate for the month of April is on average 14.7%. So the question is, have the measures announced by the president last month really worked? In my view, this is what we must grapple with tonight. Every time the president imposes these restrictions, there is a trade-off. On the one hand, he is seeking to contain the spread of the virus, but on the other, there is an economic cost the country bears. That cost is only worth bearing if the measures are having the intended impacts. If there is any sign that the trade-off is paying, is there any sign that the trade-off is paying off? The experts may have a better view, but the numbers as they stand seem to suggest a change of course may be necessary. For example, is the 8 p.m. curfew in Nairobi County really making a difference in curbing infections? And what impact is it leaving on the length of the workday, on businesses, on the transport industry? Is it not perhaps time for the president to consider moving the curfew commencement hour back to 10 p.m.? That way, at least residents will have sufficient time to work, crisscross the city, and get home in good time without the near stampede witnessed in major city termini every Monday to Friday, especially now with the rainy season. Secondly, I would propose that the president allows hotels and restaurants to resume sit-in services for clients, of course with strict observance of social distancing and sanitization measures. This way, players in the hospitality industry would mitigate the huge losses they are suffering now. It would also assure more workers in the industry of their jobs and assure them of a livelihood, even as the government works round the clock to protect and safeguard lives. Thirdly, I would propose that the president reconsiders the classification of 5 counties, Nairobi, Kiambu, Kajiado, Machakos, and Nakuru, as disease-infested zones. While at it, focus must remain on sensitizing the citizenry to observe the COVID-19 protocols with stiff measures on those who flout the guidelines. Of course, I recognize the delicate nature of the situation at hand. I know the disease is still here, but the response must take into account the prevailing situation in the country, especially now that there are no economic relief measures in place. Hopefully, soon, a solution will be found, in the words of South African Anglican cleric and theologian Bishop Desmond Tutu. Hope is being able to see that there is light despite of all the darkness. So those are my random thoughts and my punchline for this week.